Hello everyone, my name is Brittany Lopez and today I'll be presenting on closed-loop anesthesia delivery systems, a modern informatics innovation that is rapidly changing anesthesia practice. So for today's agenda, we'll start with a clinical scenario, then explore what closed-loop anesthesia systems actually are, followed by background information, key clinical evidence, and regulatory considerations. We'll also discuss legal and ethical issues, patient safety outcomes, security and privacy concerns, and the workflow implications, both the benefits and the risks. Finally, I'll wrap up with key takeaways. So for our scenario, imagine you are an sRNA stepping into a busy operating room for the first case of the day. Your patient is a 72-year-old undergoing a laparoscopic colectomy, which is complex, stimulating, and hemodynamically unpredictable. The CRNA looks at you and says, "Today you'll be managing this case with our closed-loop anesthesia system. I'll be right here, but the system will make most of the adjustments for you, as long as you watch it closely." The case begins smoothly, but towards the middle, the biz jumps, the blood pressure spikes, and within seconds, the closed-loop system increases propofol delivery faster than you could have reacted manually. Now the entire room looks at you. Do you trust the system? Do you override it? Do you wait and reassess? This moment becomes a true test of your clinical judgment, balancing technology, vigilance, and patient safety in real time. So what are closed-loop anesthesia systems? Closed-loop anesthesia systems are automated drug delivery platforms that continuously adjust anesthetic depth and use real-time physiologic feedback. They integrate data from BIS, blood pressure, heart rate, and pharmacokinetic and pharmacodynamic models. Think of them as the autopilot of anesthesia. They aim to maintain stable anesthesia levels by reducing human variability, improving consistency, and adjusting more rapidly than manual titration. The concept isn't new. Early prototypes appeared in the 1980s, but the technology wasn't mature. Sensors were unreliable and computing power was limited. Advances in EEG technology, especially BIS processing, made hypnosis control far more accurate. Improved PK/PD models made real-time titration safer and more precise. Interestingly, closed-loop systems are used more internationally than the US, largely due to regulatory barriers. More recently, we've seen multiple loop systems that simultaneously control hypnosis, analgesia, and hemodynamics. Clinical evidence. The evidence overwhelmingly shows that closed-loop systems deliver more precise anesthetic dosing compared to manual control. They minimize the time patients spend in states that are too deep or too light. These systems respond rapidly to surgical stimulation, improve BIS and hemodynamic stability, and reduce clinician workload. Several studies highlight these advantages. Casas and colleagues showed that BIS-guided closed-loop systems kept patients within target hypnosis ranges significantly longer than manual TCI. Loeb and Cannison demonstrated that automated systems respond faster than human clinicians. Justine's study in older adults showed fewer episodes of EEG suppression and better post-operative cognitive outcomes. And Kolkenberg's review reinforced reductions in variability and improved physiologic control. In the U.S., closed-loop anesthesia systems fall under FDA regulation and must demonstrate robust safety features, including redundant fail-safe mechanisms and clear algorithm transparency. These systems must always be supervised and fully overridable by clinicians. U.S. implementation has been slower because of the strict regulatory expectations, but hybrid automation models are gaining traction. Legally, the clinician, not the device, retains full responsibility for patient outcomes. Automation does not remove liability. Ethically, providers need transparency regarding how the system influences care decisions. Automation bias is a major concern. If the system makes rapid adjustments, providers might be tempted to trust it without critically assessing the situation. Maintaining manual skills and situational awareness is essential. Closed-loop systems can enhance patient safety through more stable anesthetic depth, reducing risks of awareness and overdosing. Studies show decreased EEG suppression, which may improve post-operative cognitive recovery, especially in older adults. Automated vasopressor control reduces hypotension events, and consistent application of evidence-based targets helps improve outcomes. But all of this still depends on vigilant human oversight. One informatics concern is cybersecurity. Closed-loop systems rely on real-time physiologic data exchange, which could be vulnerable to unauthorized access or data manipulation. Device logs may contain PHI, so they must follow HIPAA requirements for encryption, secure storage, and restricted access. Hospitals need strong firewalls, audit trails, and authentication measures to protect these systems. These systems offer significant workflow advantages. They reduce repetitive manual adjustments and lower cognitive workload. Clinicians can focus more on higher level decision making and anticipating patient needs. They also standardize anesthetic delivery, reduce provider variability, and support enhanced recovery pathways. But automation also creates new risks. Automation bias can cause clinicians to overlook subtle malfunctions. Providers require formal training to interpret the system's behavior and override safely. Sensor artifacts or algorithm errors still happen, and clinicians must remain engaged and observant. Closed-loop systems are powerful tools, but not replacements for professional judgment. So, to summarize, closed-loop systems improve precision, stability, and safety in anesthesia delivery. Evidence shows reduced variability and improved outcomes. However, regulatory, ethical, and cybersecurity considerations are essential. When used responsibly, these systems enhance provider performance without replacing human expertise. Closed-loop anesthesia represents a meaningful step forward in modern anesthetic care. And that wraps up our presentation. Thank you so much for your attention.